Orthopedics at St. Thomas Health Services is tops in not only the Middle Tennessee region, but also the nation.
Top 5 in Tennessee for orthopedic services.
5-star rated for spinal fusion surgery.
Top 5% in the nation for spinal surgery.
5-star rated for joint replacement surgery.
5-star rated for overall orthopedic services.
We are by far the leader in orthopedics at this point. Right now we have 40% of the market share, which is outstanding. Joint replacement, we do 2,700 joint replacements in 2006. Our closest competitor was HCA's 8 local hospitals that did right at 1,100 joints, and Vanderbilt at about 400 joints. So I think the numbers speak for themselves that we are the leader. We have more physicians on staff at our facilities than any of the others.
St. Thomas Health Services is home to 2 major orthopedic groups, Southern Joint Replacement and Tennessee Orthopedic Alliance. The program is now coordinated through Service Line Executive Bubba McIntosh.
It really does help to have some coordination from a higher level because it really is a system and we are spread across the system. It really helps to have a person in place who can be the go-between between the institutions and us. And the system as a whole.
With such a strong focus on orthopedics, both St. Thomas and Baptist hospitals have centers dedicated to joint replacement patients.
It's an exciting time for St. Thomas because we've just opened a joint replacement center. What that is a reconfigured, remodeled, refurbished center upstairs with new patient rooms that have been completely redesigned, much bigger physical therapy area, and a emphasis on quality of patient care. So dedicated nurses who are not only orthopedic nurses, but orthopedic nurses who have a lot of knowledge about joint replacement, so that it's an effective way to help patients get well faster, get home quicker, get back to their families and their jobs earlier.
Both centers are designed to offer quality care in a hotel-like environment. But St. Thomas Health Services is also at the forefront of orthopedic technology. The latest is a navigation system for joint replacement.
It is a way to use a CAT scanner during an operation for a hip or knee replacement. What navigation allows us to do is very precisely place implants. And by precisely placing implants, we improve their function, we improve outcomes.
As healthcare providers for the NFL Tennessee Titans and the NHL Nashville Predators, St. Thomas Health Services is also at the top of our game in sports medicine. From the pros to weekend warriors and promising athletes like Tiffany Gooch. For Tiffany, softball is tops.
This is very important to me. I've played since I was 5. I'm hoping to go to a D1 college and play for 4 years.
Hopes of a softball scholarship almost ended earlier this year for the high school sophomore.
I was playing softball one day and I was running after a ball, and at the last minute one of my teammates had called me off and I had stopped so I wouldn't collide with her, and I ended up stopping too quickly and my knee stopped and it locked back, and I guess it just tore it off.
Tiffany had torn her ACL, anterior cruciate ligament, an injury more common in girls than boys. After surgery to reconstruct her ACL, she began rehab with Baptist Sports Medicine. She's now part of a Baptist Sports Medicine research project designed to help athletes particularly avoid ACL injuries.
We're getting a large number of athletes who are coming in who are about 2 months post-op ACL reconstruction. At that point, their physicians are asking me to take a look at them and to see if they demonstrate some of the what we call, or what we term, pathokinematics that these athletes come in with that predisposes them to re-injury of their ACL. So we reevaluate that, we see where they're at as far as their strength goes, as far as their kinematics goes, what kind of activities they're able to do with sport and things like that. And then we put them into our ACL prevention program and then run them through that program.
Tiffany was happy to participate in the research, but even more happy that with rehab, she will be able to return to the sport that she loves in January.
I feel that this program has helped me a lot. It's helped me get stronger and know how to not tear it again. Yes, I feel like this will help my performance a lot. It's gotten me stronger than I really was before.
Under St. Thomas Health Services, outpatient rehab at Baptist, St. Thomas, and Middle Tennessee Medical Center have merged under one umbrella. There are now 12 outpatient clinics throughout Middle Tennessee. From preventing and rehabbing injuries in young athletes and even the pros, to joint replacement in seniors, and the latest in technology and orthopedics, St. Thomas Health Services is tops in the field.
For the patient, anybody and everybody wants to see an expert, and that's what I would want for my mother, and we feel like we can really offer that quality and high standard to our patients.